Okay, so we're up good numbers, so I think we'll start because it's a short webinar. So welcome everyone to this webinar. Just some housekeeping. First of all, this is being recorded, and then the recording will be available on YouTube, where we put all of our Digital Pharma Unlocked. Just search 28B Insights on YouTube and it'll come up, and we'll also post the link in the community on the meetup page. Please do use the chat room, jump in there and have a chat with each other, get some good conversation going. It should be open to everyone. But if you're going to ask the panel a question, which we're hoping to do, please do put it in the Q&A, not the chat, because it gets lost in the chat. By the time you've asked it, if it's a busy chat, it'll float off screen. And then if you're up for it, we'd like to open the mic to anyone that's asked a question rather than me reading out. It feels better if I can pick on the attendee, and I'll let you ask your own question of the panel. Right, so who am I? My name is James Harper. A lot of you will know me. I run a company called 28B, and we focus on enabling field teams, that's both medical and commercial, with data, content, and technology. So that means we rub up against compliance a lot. And I use that word rub up because I think that's one of the reasons we're having this meeting. Is there's lots of sides to compliance, and there's lots of issues around it, and lots of opportunities and challenges. Who is the Digital Pharma Unlock community that you've all joined to attend this meeting? Basically, I put a post up on LinkedIn on the death of the rep in June, and it hit 250,000 views, which is pretty big for our industry. So clearly a passionate topic or a hot button topic. So we decided to run an event in London, hybrid event on that. And we kind of formed this community around that. And what we're looking to do is to tackle big issues, big challenges in our industry, and be deliberately free, deliberately open, and deliberately daring around that. No one's being paid to be here, etc. It's free and it's open. We just want some honest, open dialogue to move things forward in our industry. We have 536 members, and there was 205 people registered for this event, but we're expecting, and looks like we've hit about a 30 to 40% conversion rate. So thank you all very much for turning up, and thank you to our panelists. For this session, we are focusing on compliance, and you could say compliance in the digital age, or Stephen put it, is digital fit for compliance. What we'd just like to do is explore some of the challenges and opportunities in the area. There's been such a proliferation of content, of channels and new technologies that, there's increasing numbers of, or you could see them as challenges or see them as opportunities that are occurring. So we brought an esteemed panel of experts together to discuss that. I'm not going to introduce them. What I'm going to do is ask each of them to introduce themselves, to say what their role is, and then what is important about compliance to them in relation to that role. And then we're going to follow a bit of the content journey. So starting with first principles and ideation through to creation and approvals to release and follow up, because I can't say each, because obviously everyone touches content pretty much along the whole journey, but there's definitely some people that are at the beginning of the content and at the release of content. I am going to be a chairman, and I will try not to be opinionated. It's very difficult for me. I'm a relatively opinionated person, but I am going to try to be a fair chairman here. So on that note, I'm just going to do that thing where I start around my screen, and Stephen, you're the very first one to my right. So if you'd get going, please.
Yeah, hi everybody. I'm Stephen Hickey. I'm the CEO of Digital Control Room. And for me, compliance is the operational process of enabling an organization to adopt policies that they've created to meet various requirements, to adopt digital tools and automations, to give them back the controls they need to implement those policies, and ultimately to provide reporting, insights, and audit points so that they can demonstrate compliance.
Thank you. And Matthew?
Hello, my name is Matt. I am a medic by background. I run a consultancy specializing in medical affairs and field medical called LUCENT. I've been in the industry for about 20 years, and my interest in compliance is really as part of the broader medical affairs value add package, and making sure that anything that touches on compliance and anything that is related to making sure that things go smoothly on compliance is integrated into the overall medical affairs workflow and goes as smoothly as possible. And therefore, of course, a lot of what is going on in digital at the moment is front and center of that because of the lack of clarity and a lack of fixed pathways in the digital compliance realm. So a lot of the thinking we do is about how we make sure that the compliance is running as smoothly on the digital side as possible. Thank
you. And Rina?
Good afternoon, everyone. Thank you, James, for the kind invite. So I'm Rina Newton, and I'm a code expert. I wouldn't say I was passionate about the code because, you know, that would be weird. So I'm passionate about making compliance clear. So to me, it's not really about what the code says or what PMCPA guidance says. What I'm really interested in is how do these case rulings, when they come out, how do they affect us? How can we interpret them? How can we make them work for us? Because we all know the code and compliance, you know, in the UK is only enforced on a complaints basis. And I think we're all pretty sick as an industry of listening and learning on how not to do it. And I think we just are all desperate to hear about how to do it.
Thank you, Rina. And Emma?
Hi, so I'm Emma Hyland from Veeva. I've been with Veeva for 7 years. I lead our strategy team in commercial content, which means really focused on the products that we have, which are Promomats and Medcoms. Prior to that, I worked for an organization that many of you may know called Zinc, or Zinc Ahead. So I was there for 10 years from the very early days. So at some point during that time, I think my mentor and good friend, the person that set up Zinc, James Brown, said, so I think we've devoted our careers to job bags. And it was that realization that made me go, oh, yes, okay, maybe I'm in the wrong job, but no, I'm not. I'm here because I do feel passionate about it. Maybe not about compliance, Rina, as you say, but about that technology that can enable content to get to market compliantly. So hopefully I can bring some of that aspect to the conversation today. And again, thanks for the invite, James.
You're very welcome. Thank you, Emma. Finally, Nick.
Hi, yeah, thanks for the invite, James. Yeah, I'm Nick Broughton. I'm a medic by background, been in the industry quite a long time. I just say over 20 years now. I'm a founding partner of Ethos, Ethics and Compliance, and we provide education and support to signatories and reviewers and creators in industry through our programs. As far as compliance is concerned, the big thing that I talk a lot about at the moment in sessions and with signatories and things is to say, you know, compliance is not the end game. Compliance is basically just about upholding some fundamental moral principles that we should be seeking to uphold anyway as humans. And it is not the be all and end all of ethics either. It's not the point of what we do. The point of what we do is to bring benefit. So to patients. And if we get, if compliance is getting in the way of us bringing benefit, then it is sometimes unethical if we're allowing compliance to unnecessarily get in the way of bringing benefit. And that's a surprise to some people sometimes. So that's my perspective on compliance. It's not the whole story.
Thank you, Nick. And in fact, that's where I'd like to start, is with sort of the first principles, the ethics, etc. So we're kind of going to follow the content journey here, like, because it is kind of the content and technology we're looking at. So at the very first point of whether it be a campaign, whether that be social media or a website, whatever it might be, like where do you believe, Nick, that conversation starts when you're thinking of patient first? How does that come about within an organization? How do you start that conversation?
I think the conversation starts around what are we seeking to achieve for that will ultimately bring benefit to patients, and I'm always drawn to the George Merck principle and what he expounded back in 1950, whatever, which I've oft quoted, about the fact that, you know, the aim of what we do is to bring benefit to patients ultimately, and if we do that well, we'll make money, and the better we do it, the more money we'll make. And I think that's a really sound principle, because a lot of our conversations and the way we think at the moment when we're designing things is the paradigm we're operating to is one where we try and work out what's going to make us most commercial benefit. We sling it at a compliance sieve and we do whatever comes out the other side of it. And I think there is a way of actually, if you start from the point of view of what's in the patient interest, and yet from that, what's in the business interest, that you can actually be meeting business and ethical and compliance considerations at the same time. And that's the place to start, centered at the patient. It is, it's a slight mystery to me that we're now having, well, it's not a mystery, but it's ashamed perhaps that we're having these conversations about being more patient-centric. How did we ever not become patient-centric in the way that we think about things? So that the key is to me. And in terms of organizationally, and I'm sure it's something that others will echo, to me it's about having all the commercial and medical and compliance people all in the same room at the beginning of the ideas, not halfway towards the end.
Yeah, so I made reference to, in fact, as opposed to complaining about line breaks in responsive design, right? And it was stopping us getting things approved. And quite rightly, when we were talking about this meeting beforehand, and we had a pre-meet stuff, there's the technical guidance, and then there's the right thing to do. And a lot of the time, and Rina, to your point, I think you made earlier, is as agencies, sometimes we can kind of just throw things at people last minute without bringing them along. So Nick, what you're saying there, my interpretation of that is communicate early, cross-functionally, and talk patients first. But as you say, that the patient benefits will come along with commercial benefits, will come with patient benefits. And yeah. Matt, I'd like to turn to you, because I know that in the past, a large pharma company, you sort of put together a group like that would look at risk and try and make that a cross-functional, collaborative approach to risk and benefit, and what you were going to do. I think it was called the Digital Compliance Champions. Is that right?
Yeah. So I think reflecting on the emergence of the discussion around digital and compliance, a lot of the challenges that were coming out weren't as a result of restrictions or necessarily what people thought. It was just a lack of clarity about where we were, and that lack of clarity is always a challenge, both on the regulatory and the compliance front. You'd rather have very, very tightly restricted guidelines that are explicit and everybody knew about than no guidance at all, and that no guidance at all results in loss of confidence in the organization, but also a lot of variability across different parts of the organization, medics in different parts of the building signing off to different standards, final signatories taking different approaches to things. So we went about setting up a centralized kind of discussion group, reasonably informally, but drawing on different parts of the business and bringing in anybody with a compliance hat on from any part of the business. It was mainly final signatories, and just chatting through the challenges that were in front of people. And the intent was to flesh out some of the key challenges, to have an open conversation, to admit that we didn't really know the answers to them, but we could still discuss them and come to a position on them. And in doing so, to decrease this variability across the business, and also to try and create these digital compliance champions in every part of the business, so that when something came up in a therapeutic area that was to do with digital and compliance, somebody would point to one member of the team and say, they're the people we should talk to. And if they didn't know, they could then bring it to that committee. And it worked very nicely. I think a core part of it was just entering into it with a spirit of nobody really knows the answers to these things. There isn't an expert in the building that we can all go and speak to, but that as a group, we were the best guess, and that the more open we were and the more transparent in our conversations, the more knowledge we would eventually gain. It was a success in terms of setting out what it tended to achieve.
Thank you. And I'm going to come back to that point about final signatories or compliance champions having to be an expert in social or an expert in web or SEO and etc. That expectation that suddenly you have to know everything rather than knowing a little bit, and how you turn to that. But Rina, I'm conscious you made a point right at the beginning, which is you're passionate about the code, but you are passionate about making it clear, and what Matt was talking about there, and I think Nick alluded to it as well, is the interpretation is a difficulty, right? It's a grey area was Heather's go-to phrase, etc. So What's your experience? I mean, how do you go about dealing with that, making compliance clear, and maybe looking for consistency throughout an organization rather than variability between brands or functions?
Good question. So I tend to try not to talk about the code being grey. I find that when people are saying, oh, the code's so grey, it's because what they're asking, their question is incredibly grey. So the first thing that we really focus on is trying to get a very specific question from whoever's trying to find a very specific answer. So if it's things like, there's nothing in the code about vloggers, well, how do you want to use a vlogger? In what capacity? Who are they? Are you paying them or not? Will there be a contract? Are you liable? Are you responsible? You know, the more you can throw questions at them, and a good signatory, I'm sure, you know, Nick would agree, a good signatory doesn't always have the answers. A good signatory is asking all the right questions. And so I go back to what I was saying to you last week, James, that I don't think that medical signatories need to be digital experts. I think they need to have a good working knowledge, just like digital originators need to have a good working knowledge of compliance. Neither of them need to be experts in the other person's field, but they all need to know what are the key questions I need to ask. And if I don't know what a vlogger is, then I should feel comfortable in saying, I don't know what that is, because it's the embarrassed signatory that will block something and say, actually, I'm not going to approve this because I've got no clue what this is. So making compliance clear is a combination of good questions and having this attitude, a slightly humble attitude of, I am totally willing to learn a little bit more about this area that I didn't know anything about. And if you've come in with a big ego and that approach to not learning anymore, then you're going to have a problem. And as Matt said, then you're going to have signatories with inconsistencies, because the code is just the one book and guidance is one book. And yes, case rulings can be inconsistent, but really when you get to company level signatories shouldn't be inconsistent. So that is something that we probably need to work on.
Yeah, go on.
As I reflect on that, Rina, perhaps one of the most powerful things we did with the group that we convened a year or so ago was to start it from a position of nobody in this room is an expert. And I think the acknowledgement right up front that we were a group of people who were pulling together to get better at something and to share best practice across an organization, but with the fact that there wasn't anybody in the room who had the answers in the first place, was quite an empowering thing, because it meant that people were happy to raise their hand and say, I've got this issue in front of me and I don't really know where to turn with it, and for others to discuss it. And multiple times I think we were caught out by some of the things that were on people's table at the time, and people are no doubt were thinking, goodness me, I don't know how I deal with that either, so I'm really interested in the conversation.
And the other thing that, you know, sometimes we talk about is the two-way exchange of information. So don't just expect your agencies to get code training from you, expect to get digital training from your agencies as well.
So just on that point, funny enough, we've had two questions and a comment. So Bridget's made a comment and Joe's made a question as an anonymous attendee exactly about this, is, you know, should it not be the signatories shouldn't be the digital experts, the digital experts should be code aware, right? And I think rather than it being this two sides of something, who should be the expert? I mean, we can't all be experts in everything. We need a certain amount of knowledge. And I really liked your point, and maybe invite comment on this, that being humble about a lack of knowledge. You know, I think our industry, I think maybe work in general is getting a bit more open, where people can feel more comfortable to be authentic about what they know. But there is definitely, I can't be seen not to know this. So that coming at it with a humble approach and asking from training from both sides. I don't know if anyone has something to add to that.
I would just add, James, if that's all right. Sorry, Nick.
No, carry on.
I was just going to add that the questions that Rina asked were, many of them, the examples were, who's the audience? Are we paying for them? Is there a contract? That's not digital. It's the same questions that should be asked about anything. But then the question is, why should they be asked? I suppose that information should be available to a final signatory. And it really should be just I don't understand this channel or how it's going to be used. That's the specific training piece that perhaps is missing.
Yeah, and maybe demystifying, as you say, a vlogger. Is that the equivalent to a KOL speaking at an event? You know, what's the parallel? What are we used to? What have we come from? You know, just because it's a new channel doesn't mean it's actually a new form of communication. It's just a different way of presenting it. So sorry, Nick, you had something to say as well on that.
No, I think the idea that you have to specifically train people, I absolutely agree with Rina on the language thing, that, you know, it is a big trip up within teams that people don't understand the language and aren't prepared to say they don't understand it. But I don't think it's specific training. Again, it's back to me about teams getting together and talking, and it becomes organic learning the language, because you see how it's presented, you work out what it means from the context. People don't have to put their hand up all the time and say, well, what's that mean? What's that? But if they do need to, because teams working closer together, it's not a big issue. The other thing I would just say also about language that I found is that a lot of the people on the digital side of this, when they're using certain words, use those words in ways that they understand that word to mean. But actually, when you investigate them, other people in other digital roles use the same word in a different way. So the idea that many of these terms are sort of universally understood by everybody as the same thing is not true. And that's another reason why people just need to talk to each other as much. You know, what do you mean by modular content, for instance?
Yeah, I very much agree. Having a like a single source of truth for what this organization believes the following terms mean. You know, whether, you know, we hear customer 360 and CRM and all these different phrases, and it's actually, what does that mean to us? Why do we use it? And what etc. So that everyone has a level playing field, the same rules for then interpretation to happen.
Yeah, if I may, you know, I come from an operational and technical background, and you know, working across many sectors, you really have to kind of meet in the middle, I think, is the point many people are making here. You know, bring tools, you know, if you're relying on spreadsheets, emails, and the like, it's a tough ask. That's sort of last century. There are great operational tools out there now to help codify a policy, or at least guidance, you know, within a certain company, so that others can pick up and read that as well, and iterate on that. You know, don't stand still, don't do nothing. You know, do that regularly and improve the process, but meet in the middle and talk.
From a philosophical point of view, I don't think that the rise of digital has done anything other than magnify the things that would have been best practice anyway prior to any digital content. Best outcomes in a team are always working cross-functionally, having somebody in the room who's the final signatory, but having everybody empowered to discuss compliance and the implications of compliance. I find the worst outcomes are when somebody looks to somebody in the room and say, can we do this, as if they're an advisor and an expert. And that's true of print as it is of digital. And in the initiative I was describing before, we were fortunate enough to have a number of people in the room who were not on the compliance side and not final signatories, who were very well versed in the code and happy to challenge, and a group of final signatories who were very happy to welcome that challenge and to discuss it rather than see it as a challenge to their authority. So I suppose it's not anything new that wouldn't already have existed pre-digital days, but the digital, or the rise of digital, has just really magnified that relationship.
And anything, do you think digital's made it easier for people to review the content? Because if it was print and out there, you know, where is it? At least, as tough as digital is, at least there's kind of that, if you can create that single source of truth, it's at least somewhere to look.
I was about to add that, so digital is also a massive opportunity for exactly that reason, Stephen, and, you know, Emma, I'm sure will speak to this, but the fact is that now we have mechanisms to make it more compliant. And what we'll often hear is that as soon as you introduce something new, then you'll hear, but what if someone abused it in this way, this new channel in this way? And you go, but look how much more compliant here, not talking first principles, than it was before. You know, moving from Outlook's free emails to rep triggered emails, which suddenly give you that next level of opening to communicate with HCPs. But as soon as you introduce something new, of course, there's the, how can it be abused and how do we control it more, etc. So I don't, Emma, if you want to talk to, you know, the opportunity of digital content and automation to reduce the technical burden or the box ticking exercise of compliance versus Nick and Rina talk about, and Matt talk about in terms of first principles and patient benefits.
I'll talk about the opportunity. I love talking about the opportunities, but I will acknowledge that digital is in many ways harder though as well, not just because of the understanding of elements as we talked about, and it being, you know, new channels, but just that description of, you know, the final form. What is the final piece? What are the reviewers actually looking at? And And that varies massively across different organizations and people approaching it in different ways. So, you know, actually one of the things I'm looking at is ways that we can help with that and make that more consistent as a process and a way of working. But I do think, yes, the opportunity is there, of course, where you can digitally publish the content that Nick signs off gets pushed out, and it's that actual version that is then in the market. Then there's a problem with it. You cut that link and you get it back immediately. You're not having to, you know, source them from reps' booths or offices or wherever that printed content might be. So there's, you know, yes, digital can be more compliant, but I think that upfront piece to help make sure that it's approved and compliant, there are more opportunities for us to automate that process, but acknowledge that it is different. And in some ways at the moment, sometimes it can be harder.
And we must also recognize, I think, was it the last 6 months or the first 6 months of this year, there was another 80% increase in digital content on Vault, commercial content on Vault. I can't remember the exact figures, but, you know, ever since COVID, there has been such a significant uptick in the amount of content that people are being asked to review and sign off, you know, and that's not just from a compliance perspective, but the, you know, marketing signatories, the agencies, you know, buckling under the stress, etc. And as you say, Matt, I think that may well have just increased some of the issue, or magnified some of the issues that existed previously.
Yeah, volumes are just monumental shifts, I think, in the volume of content that we are churning through as an industry. I looked at the data because James saw me present it last week, but quite specifically, there was over 500,000 new pieces of content in Europe last year that have passed through many of the people on this call's desks at some point or another. So yeah.
The digital helps you do that. Before we move into the what I'd like to call the content in the wild, Stephen, because I know you're an expert in that space, and I'd like to talk about that. There's just a few of the sort of question and comments coming up, and Amanda's asked, and Amanda, I won't open this to you and ask this, we'll come on to that, but you've asked about the recent PM CPA guidance on banner ads, which Rina put a funny face on, because of course that's an example of very specific do this, not this kind of guidance. So I'd like to just for us to talk for a minute about that first principles versus the technical guidance, right? So I think, Nick, you made a point when we were preparing for this, that is, just get the technical guidance out of the way so you can focus on the other. And I put a question out to everyone here is, does that super focus on the technical compliance bit get in the way of those first principles in your experience?
I think it does. I think we've got to sort out the important stuff when we're reviewing materials and the less important stuff. And some of these technicalities, you know, I ask him, if we're going to first principles, and I ask myself, do I, you know, ethically, what do I think about where the adverse event reporting statement is? Well, frankly, I don't really care. And that's not being I'm just saying, I will do what requirements are in place, but it's not something I'm going to debate with people or argue about, because it's not. Some of these things just need to be sorted out, and in a way that a company agree, you know. And I agree with Rina in the extent of, you know, agree with in your company how you are going to do final form, where you're going to put the adverse event reporting statement, are you going to call it PI or prescribing? Just make a decision and go with it and sort it out, and everybody on the same page. But where I'd slightly disagree is, I do think, you know, or I'd say something slightly different, is that let's concentrate our disagreements where we do have disagreements on the important stuff. Is this a claim we can make? Does it put anybody at risk? Is it, because there will be disagreements sometimes between signatories about where they are going to personally draw the line. But weed out the important stuff from a lot of technical stuff, because the other downside of this is that people looking at us in compliance, who are not in compliance functions, just see a big load of compliance fuss and bother, and then they can lose track of the fact that some things in compliance are critically important. You know, it's about not harming people and not lying to people, and unfortunately, those important things can get lost in this sort of morass of debate about things that frankly are less important.
Rina?
I would just add to that. I think I lost the debate. I did have a really good try at challenging the decision and talking to Alex Fell from the PMCPA and trying to convey these really big points that Nick has said there, that we're not hiding anything and we're not lying, and patient safety is important and the adverse event statement is there. You know, everything, all those pieces are there, but to the letter of the code, Alex was pretty adamant that 12.9 requires. And so the next thing, and this is the bit where I think companies will start getting nervous now, is my challenge to them to appeal.
Yes.
You know, we know the PMCPA will find it in breach. And what we find, and it irks me because I have, you know, people say to me on LinkedIn, well done for saying that, but nobody likes or shares that post of mine because they're a bit scared of the PMCPA. Because at the end of the day, the PMCPA are the ones who rule on their case. So go Rina, but, you know, don't let them know that I back you up on that. And so if we don't appeal these rubbish decisions, appeal board have the last say, not the PMCPA. If we don't appeal these decisions, then they will just sit there forever. So we don't input into the code and we complain as an industry, we don't like what the code says. We don't appeal decisions and then we don't like the decisions that are made. So we just got to get a bit of oomph about us and go, right, what's the next step? Let's take it to the next level.
I've said to one or two, I absolutely agree with you, Rina. I guess, you know, in that statement, they said, you know, the appeal board have the last say, right, let's take it to the appeal board.
Right.
And I've said to some people that, you know, I'll offer to help. I'll help you write the letter. I'll do it free, gratis.
So
and I'll
will
say
I.
that on this
So will
call
I,
now.
Nick.
So
Brilliant.
let's join forces on this.
There we go.
I will help you write the letter free, gratis to defend it at the appeal board if it's the worry, if that's what's worrying.
Great, thank you. So we've had a question which leads into, Stephen, what I was alluding to earlier, which is content in the wild. So it's for an anonymous attendee, so I can't open the mic up to them, but does digital also pose a challenge where content may be shared via email and the link can't be cut in order to edit the content where it's needed? So what I talk wider than that question is, you know, yes, there are mechanisms to publish things and then change the source of truth, and that changes, but there's also a lot of content that leaks out into the wild that no longer is within the control of the originating company, and yet we're still responsible for it. So I don't know if you, Steve, you want to talk about, because your experience, I think we should say for the audience, started outside of pharma, right? Is that right? You started out in financial compliance?
Yeah, we started out with ICO regulations around cookies and the like, and then moved into GDPR, as everyone's familiar with. So we've got quite a broad range of experience with different types of companies that are looking at digital governance broadly. So yeah, and there is the content in the wild, and to Emma's point, there's a lot more content going through compliance sign-off and being published. But I suspect there's still an awful lot of people and agencies putting content online, running campaigns, forgetting to take things down as well, especially. There's a lot of out-of-date material, and other things we've seen where, you know, a delivery type has changed from tablet to capsule or vice versa, and the efficacy has changed, and yet still old materials on there. So that's the kind of danger, as I call it, around, you know, patient safety and the like. And what we try and do is we try and close that loop from what's out there, bring that back to the business so they can iterate, update, improve, and republish.
But to do that, right, you have to have a clear set of rules, and some of the rules are really clear. We just talked about one that's just been made very clear. So, and I know you're already working with various large pharma. Have you been able to work with cross-functional teams to define what those rules are? We just talked about how they could be interpretive, etc., and what Matt did with the Digital Champions Group to a degree, and what Rina and Nick were talking about is, as an organization, this particular pharma company, maybe this brand, but hopefully wider, this is how we will approach this situation, because you're going to need that black and white guidance, because yours is, you know, is algorithm based, right, or rules based.
Yeah, it's interesting you say black and white, because of course you got the GDPR, for example, a regulation, and then we know that every company and organization interpreted that ever so slightly differently, and even wrote their own internal policies to meet that regulation. And we've even seen, you know, regulators themselves fall foul of other regulators, you know, guidance and the like. For the example of the PMCPA, and to Rina and Nick's point, if we could find that quickly and know whether it was right or wrong and present that back to us, we could just take that off the table so you can then concentrate on the things that you do. But it's about taking, each company will have different policies, and it's how they interpret that, and then how they clearly communicate that to people. And ideally, that's where we come in a little bit. We codify those policies, and we go look for what they need to look for, and apply rules, whether it's a pass or a fail. And then those results come back, and let's say they do that quarterly and they iterate on that. It's always changing, always improving. It's never black and white. It's never pass and fail. It's, constant movement.
And that's something that we all need to be aware of in digital. It is always moving. There's always new technology, there's new mechanisms, new channels, and it needs to be flexible. So I'm going to do a fairly shoehorny segue into the pending PMCPA digital guidance. And I don't want to get too deep into that because we don't know what's in it, but one of my concerns in that area is it could well be out of date within moments of it being released. Can it ever be true digital guidance in the sense of, are the people putting it together real experts and really on the ball, or are we going to get just another set of things that can be interpreted, etc., that we have to tick boxes on rather than it addressing? I really liked what was said right at the beginning. Just because it's a vlogger, actually, what's that analogous to? Who's being paid? What are they saying, etc.? Will more guidance help or hinder? Open question.
I'm not sure what you want, what we want guidance on, and what do we need to know that we don't know already? I'd like guidance on some of the things that I see companies wasting countless man hours on, about how to sign things off and what the final form is, and do that sort of stuff. But in terms of why would you seek advice from the PMCPA, who are not acknowledged experts in digital, on how to achieve things in the digital space? I agree with what Matt said earlier. I think that in terms of what digital has done, or the options and all the things you can do in digital, it's shown actually how we didn't really understand the code of practice very well in the olden days. We had very few channels. We knew if we did certain things, everything was fine. Actually, what it exposed was the fact people couldn't think about how to apply the principles and ask those questions that Rina was mentioning, and we're still struggling with that. And I think this demand for guidance is still this sort of strange demand for write as a digital code. I don't think it'll tell you anything that will be helpful personally, unless they surprise me.
I think one of the things, it's different ends of the same piece of string, isn't it? Compliance people want, they don't, like to your point, Nick, the guidance is less important. It's about the principles. But what we've seen the rise of more digital governance teams, digital asset assurance teams. To Matthew's point earlier about digital champions, it's almost like nominating somebody in your group and making them work together as a working party to better understand what the company needs. Yeah, I think that's the solution. That there's you can't be shouting from different rooms. You've got to kind of meet in the corridor.
And just to add my view on it, I think the banner ads press release is a really good example of how horrific it can be when the PMCPA interpret the code to a granular level and impose on us their view, and then we all complain that we don't like it. We'd hate that to be in digital guidance. To Stephen and also to Nick's point around principles, well, integrity, trust, respect, independence, they're already in the code, or so at the beginning, so they won't necessarily feature too heavily. When I think about, so PwC were engaged by the ABPI right at the start of this process, early 2020, and they had a series of workshops. Now, interestingly, every suggestion was open for debate and discussion. About half of those suggestions were non-compliant. So whilst it's lovely and fluffy and all of that, the ABPI reaching out, at the end of the day, there's no point. And I think this is what's probably taken so much time and why we're still waiting to make everyone feel lovely and happy, but actually half the suggestions were non-code compliant and had to be binned anyway. So I think what we might find, one of the things that will make me unhappy is great big copy and paste chunks out of the code sitting in guidance. But then what can we really expect? Are they going to have swathes of information on vloggers or hashtags or tagged accounts? And no, probably not, because if they do that, they won't be able to make different decisions on a case-by-case basis. So when we know how the PMCPA operates, we can now set our expectations that the guidance isn't really going to massively change our way of thinking.
Yeah, I'm not expecting it to be something I can look at and then think, oh, we could codify some of this and off we go either. But I do wonder whether there is a place for it as well. I mean, I think everyone here clearly has been talking about this subject, working in it for a number of years. For those that are more new entrants to the industry, is this going to be something that'll help to clarify what we mean and how digital could work? I'd hope so. I'm always an optimist. Maybe that's it.
I'm also of my not as valued an opinion as you guys, because I don't work in compliance, don't have as much knowledge, but one of the things I constantly fight against is actually the use of the word digital, right? It's now pretty much a part of everything we do, right? However you class it. It's like with the PM Society's digital awards. We have digital awards and we have the effectiveness awards, but everything in effectiveness is digital. Everything's digital. So it's slightly anomalous for me for there to be digital guidance when pretty much every activity is it already involves digital to one degree or another. So it's like, we were almost moving away from having heads of digital and digital that, and actually marketers are now digital marketers. It's part of the role. So interesting, we're kind of stepping backwards a bit into that space. I'm going to, go ahead.
I was just going to mention on the digital guidelines front, and I'm not close enough to the detail like Rina and Nick might be to have a view on what may or may not emerge. But it struck me as being slightly strange timing, considering how far down the track we are, and that in a world in which things are getting increasingly more complicated and more nuanced, and particularly on the ethics side, therefore, people are moving towards more principle-based guidance. And this is true way outside of compliance. This is true of sort of ethics in general, and particularly business ethics, to allow people to have interpretations, but also to operate to a set of principles rather than the strict letter of the law, that this would emerge now. It feels a little bit like it's running against the stream of other things in a similar realm.
Yeah, and what I'm pretty sure it's not going to be talking about final form and modular content, which I'd definitely like to touch on before we move on this. There's some myths around modular content and compliance that I think, Emma, you'd like to talk to. But before we do, Joe has asked a question. So Joe, I'm going to open the mic, as I think it's quite a good question, if that's okay. If anyone wants to ask your question around, the just because we can, we might do.
Right. Yes. Okay. Thanks. So, I think that one of you were alluding to the amount of material that's going through Veeva that's digital at the moment, and in a way, as a sort of basic final signatory, that quite scares me, just because it's the amount. Do we actually need that volume of material? Are people really deciding whether what we're producing is fit for purpose, is going to do what it's meant to do? And potentially, I think people get carried away with the ease potentially of producing digital, not necessarily of approving it. So I just wonder what you thought of that.
Can I ask you a question, Joe?
Yes.
Right. If you're signing off a website which might be viewed on PC, tablet, and iPhone, and it's identical on all those three devices, is that 3 job bags or 1?
It's 1 in the my present role. Yeah.
Okay.
Yeah.
Can you see how, when we see these numbers creeping up,
yeah,
that sometimes there's the actual, yes, those 3 require 3 separate job bags because they're non-identical, and sometimes it's the perceived, well, compliance or someone is saying that that's 3 different devices, that's 3 different job bags. So my first question or first piece of analysis is, how many of those really need to be separate? We sign off, social media tweets. That's one job bag with 20 tweets in it. It doesn't need to be 20 job bags.
But I think also, as an external observer of the amount of content, I mean, we've grown really well over this period as a company, because the demand for content has gone up, and big, large content separately. I think so I invite you to speak to this, but a lot of people thought going digital meant more digital content, right? The knee-jerk reaction to remote access is more remote materials, whereas that may have been, not the requirement. And then also personalized content is an important thing now. We're creating digital personas, we're creating content that's relevant to this segment of customers and this segment of customers, etc. That's only going to grow, in my opinion. So whether it's one job bag or many, I think there is no doubting there is a vast increase, and it's not just job bag numbers for this. And Joe, to your point, is it the right content? What we see, not often not. It was a knee-jerk reaction to, we just need to be digital, therefore we'll do more digital content. But there is definitely going to be a thirst within our industry for more varied content, because we're looking to meet individual customers' needs and therefore personalized content.
I think we have to acknowledge not all the content that is out there is used, or used enough for it to have had the investment, I suppose, of all the signatories, etc.'s time and the input that goes in from the agencies. So I think there is more of a focus on the effectiveness of that content, measuring the utilization and measuring the effectiveness, so that can feed back into the planning and, getting it and right sizing it. But regardless, yes, with the variation of content required to be able to tailor the customer experience, there is just inevitably going to be more of it. But I think what we've spoken about, James, is there are ways, and modular content is a way to make that happen without creating realms and realms of more content, but having more consistent content that you can use across different channels. That's where we should be going.
Yeah, smart content planning and content reuse, right? But also then smaller modular content. We can't continue with. So Joe, I don't know if this is you're speaking from the heart in terms of the amount, your workload and backlogs in terms of content. That's what's driving this question?
Partly. I mean, I think I completely get the point, but if you're going to have tailored material, then that's more work potentially. But I just feel it's people get carried away on a tide of enthusiasm for doing something new, and don't actually necessarily reflect on how useful that is. And in some places, even though you're producing digital content, they may not even be counting the amount of use that digital content gets. And for me, that is crazy, because surely that's one of the benefits of digital content. So I just that's my gut feeling.
I think you make a really
interesting reflection on this is, and outside of the compliance realm, is that we have the ability as an industry to contribute a large amount of very high quality work, very well thought through content. I'm thinking non-promotional content now more than anything else, which isn't necessarily manifesting on the ground in the way which I would hope it was. I'm speaking more with a sort of a med affairs hat on now than a compliance one. But to my mind, any medical plan these days should feature very heavily on the high quality, rich content front for disease area, therapy area, and anything non-promotional, alongside making sure we're getting the compliance piece right. And I don't see that necessarily being enacted in this sort of new digital realm we're working in.
So I'm share an experience I had on the last one of these events. Paul Sims, who was one of the panelists, read out a quote from a UK pharma MD, and it was a long quote, but right in the middle is something that's lived in my head from that day forward, which is, with the backlog of patients in all of the countries, including the UK, it's now a moral obligation for us as an industry not to waste our customers' time, so not to waste an HCP's time. So part of that journey for me, and really importantly in my role here when we're helping to create that content, is the evaluation of that content. Is it being used? Is it being rated well? Is it seen as high value? Because if it's not, we're wasting someone's time with it, and not just the people that created it, the people that signed it off, but the people that are reving it, and will be undermining the trust and value that we add to our HCPs.
I mean, I think Joe makes a really good point, and often, you know, if I'm reviewing materials, I can't say it's non-compliant. You can put it out there if you want, but it's not something I'd want in my inbox. I wouldn't go and visit this website. Even to Matt's point, I'm not sure I'd visit a company website for disease area information. My challenge, it's probably beyond the remit of this particular session, but is, you know, whether marketing is up to, as we're doing it, is up to speed with digital. We are essentially, a lot of people, at least the way I see it, essentially putting out what was being put out 30 years ago in hard copy, just in a digital format. There is no, you know, yes, we can introduce the content in different ways and such, but the way of putting out the nature of the content is much the same. It's, you know, our product is better than your product. It's got, we've got some graphs to show it, and things. And I just, you know, it's more a question about, sometimes I'm looking at this stuff that we're producing, and to your point about, is it a moral issue if we're wasting people's times? Well, sometimes I think perhaps we are.
Thank you for joining us, Joe. I'm going to move you back in unless you have any last comments.
No, just thank you.
Okay, thank you, Joe. We have another question here. This might be quite specific. I'm going to read this one out because it's anonymous, and I don't know how this is going to go. If digital compliance is variable and open to interpretation, is being, say, 95% compliant good enough? And does the panel believe that the PMCPA's own online presence is 100% compliant?
You know, I had many years ago, I had an amazing managing director at AstraZeneca, Chris Brinsmead, and we were one of the first companies that had a compliance strategy. So we used to talk a lot about if your compliance department function strategy is like a fishing net on a fishing boat. The larger those holes, the more you let through, the faster your boat goes. But if your net is super tight and you want to try and achieve 100% compliance, well, then your boat won't go very fast. So it's about, you have to decide internally, what is your risk appetite? What is your risk environment? Are you even aware of what plan B is if, you know, the proverbial hits the fan? If you go into this with a finger up in the air, then, you know, it's not going to go well for you. But are there ways that we can talk about considered risk taking? Yes. And those are the conversations I love to have. I'm not in any way sitting and talking about compromising patient safety or completely ignoring the code. I'm talking about pushing the boundaries and doing things in slightly different ways that haven't been tested before, because that's actually what makes compliance quite exciting and sexy, if I am the only person saying it.
I'd agree with that. But I think the questions to some extent reflects the problem. We sort of talk about compliance as if it's one thing. Well, to be honest, if you go for 100% compliance, that's, you know, your boat's going to sink. You know, you're not going to get 100%. But there's been non-compliant in little things, like I said earlier, that really I can live with, and I'll, you know, go to the appeal. I can live with that. But we've got to be compliant in the big things. You know, we can't be doing things that are really putting people at risk, and it's getting people to appreciate it isn't all one thing. There are some things that are much more important than other things. We've got to get the big stuff right, but the little stuff we'll have a risk call on it. And yes, we are going to be non-compliant now and again. Sometimes our websites are going to break, links won't work. You know, we'll do our best to make it fine, but I'm not going to lose sleep.
Well, it's interesting, Nick, you say that. To do nothing though is bad. So 95% is probably a pretty good score for in any industry, any auditor. You know, the auditor will always give you a chance. Come back, please try harder. We've seen that in all sorts of industries. And to the anonymous question, yeah, I could look at a regulator right now, and I could tell you where perhaps they're not compliant with GDPR, for example. You know. These things are hard to interpret, but to do nothing is not a defense. Ignorance is not a defense. Get going, do something, demonstrate what you can, explain your rationale, show you're working out, and
show you working out.
Shot at it, exactly.
No, but there is a case. Sorry, just to hog the conversation again, but there was a case for Daiichi Sankyo where the case went to appeal because Daiichi Sankyo Europe engaged a UK agency, and the PMCPA said, oh, if you're a UK agency, some of your followers must be UK, therefore the code applies. And we took it to the appeal board and said, the PMCPA don't know the nationality of their followers. So why have they imposed this, consideration on companies? And they overturned that breach just by asking that question. So I'll go back to the point about challenge is a good thing, a healthy challenge.
Healthy, constructive challenge, which we're always all open to. I'm very conscious of time. I've got one more question to ask, which is another anonymous attendee. It's either one anonymous attendee who's very active in asking questions or several. And the reason I ask this is I did want to touch on modular content because I do believe that modular content is a huge opportunity for our industry. From the outside, it seems like a huge digital transformation and ask. And my reaction to it is, gosh, I can't even get a modular email of 3 parts signed off as final form, or it takes a lot of effort. So the idea of all content starting to be formed up of components, sort of atomic content. So this question reads, and it really leads in, Emma, to modular content and what I'd like to speak to. In other markets, such as Italy and Spain, there is a range of guidance around what is considered final form, and thus requires reapproval. In one example, a market does not have to reapprove IMR if the content remains the same, even if the layouts have changed or minor style changes have been made. So the text, references, assets, videos, etc., are all exactly the same, but may have moved around on the page or have minor style changes. Can the UK ever reconcile final form and therefore modular dynamic content?
Can I just add something to that question before you ask it wider? We talk about styling and everything. What about, people with sight or, side issues and accessibility? They don't, styling probably doesn't even come into it.
But I would just say there is no such thing as digital final form, right? There's no, but I think, we've talked previously about this, that, well, we just need one decision of what is final form. We get that signed off and relax about the others. But Emma, obviously Veeva's a massive player in modular content. It's the potential answer to personalized content and this content boom we're seeing, rather than making everything twice or 3 times or 4 times, sort of make, reuse and reuse.
Yeah, absolutely. I think I completely agree with the panelists here have already said that the process as it stands, is the way it's always been. Everything online, sort of review and approval, hasn't really changed from how it worked on paper job bags. It's just now online. And I think modular content is going to change things, but it's not for everything. I think we have to be clear about that as well. It's when is it the right time to use it? But it is about thinking about approving elements and small pieces in a form that is accessible to the reviewers, so they can understand how it will be used. The business rules around it are really important. And then being able to use that across multiple channels in different ways. But in the UK, that requires those modules to be approved, and then it requires the final form, as it stands right now, to also be approved. So one of the challenges we see is people say, well, I'm not approving things twice. How is that actually going to save me time? How is that actually going to get us to market quicker? In other markets, we can see that it will. And for example, even in the US, you're speaking with the OPDP regulators there, they are looking at how they can approve like variations of contents and grids, and the final form being multiple variations of things as well. So all I'm saying is it is evolving. And I think the thing that you and I as well have spoken about, James, is often we are being told, well, it's the medics that say this is never going to work. This is not the right way forward. But every time I speak to somebody who's on the compliance and in the medical side of things, saying it needs to, we can't keep operating in the way we always have done, and are much more supportive of it as long as it's done in the right way and they're involved in the conversations from the very beginning.
Does anyone else have anything to add to the modular content discussion?
I think there's final form that we have control over, where there's market differences in the way it lays up, and then there's the acknowledgement that once this is in the world, you don't know how people are looking at things, which operating system they're in, which device, and even such things as resizing screens can make a market difference to how things lay up. Going back to one of Nick's earlier comments, I think that the principle of making sure the right information is available and that the patient safety is not being compromised in any way as a result of different layups needs to be considered. But the idea that we might get to a stage where you could sign off final form on modular and dynamic content is completely impossible, apart from being undesirable. So we do need to, as a group, and keeping the conversation open, to agree a way forward in which is pragmatic and allows the business to move forwards with the acknowledgement that you can never achieve what you might once have achieved in print. It's not possible.
And that's where, to me, guidance would be. That's where guidance. Tell me how practically we do this thing that we all agree is a good thing to do, and it's a good way of communicating. What do you want us to do in a way that's reasonable? Give me guidance on that, because that's not a moral issue. That's a technical issue that we can agree on, and we can all move on.
So I'm going to bring this to a close because we're at time. I'm going to ask each of you to offer a bit of advice to anyone on the call in terms of if they're struggling with digital, or like Joe didn't say that, but the excess content, etc. I don't know what you might want to leave them, but I have found this extremely useful. We often talk about sides of the fence, and I'm often on the side of the fence that feels the frustration from something not getting through or coming back with what I see as not important changes, etc. But I'm also, through our conversations and through this event, I am also very aware that we don't work hard enough to collaborate earlier, to prepare and cross-functionally discuss the materials that are coming and head those issues off earlier. The things I've taken away from this is the importance of first principles of that patient benefit. Then the commercial benefit comes with it. As an industry, if we improve patient outcomes, we benefit, and that's what the focus should be. I really, really like the clarity in the question bit, Rina, and that's a fair challenge to agencies. You said that, you're not asking clearly enough, and actually we can probably dissemble digital into some very clear basic questions about who, why, what, etc., and actually not worry whether it be a vlogger or social, etc., but kind of that underpinning first principles. And Candice made a number of points in the chat about that cross-functional collaboration early being really important. And then, of course, on the back of that, we've got automation that can take some of the pain out of this, from how PromoMats is getting increasingly, the referencing and things like that, and then what Stephen and his team do in terms of the content in the wild. But all of that requires an organization to decide what is their interpretation of that guidance to tick the boxes of compliance with having the underpinning first principles of patient safety. So that's my summary of what I heard today, and I have found it really enlightening, because I often am just thinking about line breaks and final form. It's really good to hear and enjoy that. So thank you very much. So I'm going to go around. I'm going to start reverse the when we did intros. And if you don't have it, and you always get put on the spot with this at the end of the webinar, but Nick, do you have a word of advice for people not struggling with, but new to this area, or any word of advice for people on the call?
Yeah, just as the lights have gone out because I've not been moving enough in the mirror. I think basically a reiteration of what I said. I think, don't lose the important stuff that we have to think about, the good content in the patient interest, minimizing harm, respecting people's free will in the content we produce, amongst the weeds of process. As companies, find out what your process is and follow your process, agree a process and do it. Get that bit out of the way, then concentrate on the important stuff, because some things are more important than other things.
Thank you. Emma?
I almost didn't want to say this, but it is important. Just find the tools that you have and you use, whatever they are, make sure you understand how they can really help you. Don't just use them to which buttons you press. Really understand them. There's probably a lot more that you could do with them to help with the things we discussed today. But the other thing is, don't do it all on your own. Don't figure it out yourself. Your peers in the industry, connect with them, and people are so open and transparent and want to help each other do this. That's it.
100%. Just to re-echo that on the tools, there's so much potential locked up in there that people don't have the knowledge to unlock, and it's definitely worth putting the effort in to lighten the load. Rina?
I would say my top tip is that whatever you're trying to do, it is going to be possible. I'm going to massively assume none of you are trying to breach the code or promote to the public and stuff. So if you're trying to do something, there will be a way to do it. Some things will be harder, some things will be easier, but you know, that's the good news. And if you're finding that people are saying no, then you just got to persevere and ask them, well, why? Where does it say no, and who's saying no? And remember, if it's not in the code and there's no guidance and there are no cases, which might be the case for vloggers, then that's a really good thing. It's not a bad thing, it's a brilliant thing.
Thank you, Rina. And Matt?
Yeah, just echoing what Rina and Nick have said, really, about, you know, having an open mind about this and not being frightened of getting it wrong, I suppose. There's a lot of untested ground here. There's a lot of things we could be doing. And the worst thing we could do as an industry is allow ourselves to be freaked out by getting it wrong and therefore not try anything at all. There's boundaries to be pushed here, with the caveat of not putting anybody at risk and not doing anything that would be outside of what you would expect in complying with the code. But I would like to see people being more ambitious, trying more things, and in that way we can really kind of suss out where this area lies.
Thank you. And finally, Stephen.
Yeah, and building on that, you know, start talking to people. Somebody in your organization is also thinking about this. You know, maybe somebody in IT's even started to put together some digital governance and building you know, digital champions. And if you can't find them, you know, reach out. There are groups out there. There are companies already doing this, and they're very keen to talk to like-minded individuals, even in other verticals.
Great, right. Thank you. I'm conscious we're losing people because we're over time by a few minutes. What can I say? It's been one of the best events I've chaired. Thank you so much. You obviously all have a deep experience, knowledge, and willing to share that openly in this forum. To everyone that's joined us, thank you very much. We will make the video recording available. Video recording, showing my age. We'll make the recording available, and we'll reach out to you on the meetup. And then the Digital Unlocked will be back in February, where we'll be talking about vanity metrics in terms of Salesforce effectiveness. And that's really being driven by my desire now to make sure we don't waste HCP's time. So how should we be measuring the impact of field teams out there with our clinicians? I think it should really be about the value we add, not the numbers we see. So that will be the next event that we've got to pull experts together. I hope you'll all join us on that one as well. Thank you all again very much, and have a great evening, everyone.
Thank you.
Bye.
Thank you, James.
Thank you, everyone.